Here, please, up front. I'd like to kind of just briefly first explain how we got to where we are today and why we're here. Senate Bill 2623 was passed by the legislature this last session, and it calls to set up a task force to study the state and school employees' health insurance plan and to look at plans throughout the South and see how Mississippi's plan stacks up in the way of benefits, deductibles, the whole gamut of the plan, what's covered and what's not. The legislation called for the appointments to be made. The legislation was effective July 1st and for the appointments to be made by the end of July. And that we got right up to the end of July before the final two appointments were made. And then it called for us to have an organizational meeting within 30 days of that. And we're barely hitting under the gun for that. I wish I could go back and amend one thing in the bill. It asked for us to report to the legislature by November 1st of our findings. This is the first year, as you know, of a four-month term. There's not going to be a whole lot going on in January. I don't think it's that important. Maybe Hank Zuber and I have spoken that maybe our goal will be to complete our meetings by November 1st. Then we'll come up with the findings and report to the legislature so that any bills that might be suggested to be drafted, we'll have plenty of time to do that. I want to announce, I'm Walter Michelle. I chair the Insurance Committee in the Senate, and I'd like to announce the members of the committee. Some were appointed by the Speaker, some by the Lieutenant Governor, some in the legislation. The four elected members of the legislature, the two chairmen of the education committees in both the House and the Senate, and the two insurance committees are Senator Dennis DeBar, chairman of the Senate Education Committee, Representative Richard Bennett, House Education Committee chairman, I, Walter Michelle, as chairman of the Senate Insurance Committee, and Representative Hank Zuber as chairman of the Insurance Committee in the House. It called for Mississippi Insurance Department. Commissioner Cheney is here today, and Bob Williams. They're going to be tag teaming us. Sometimes when Commissioner Cheney may not be able to be with us, he has announced that Bob Williams will be his appointee. Ms. Liz Welsh, Executive Director of the Department of Finance and Administration. And also our state insurance administrators. We're kind of in between administrators right now. Chris Shamman is on Zoom. Chris will be retiring at the end of this month, and Bert Emmerich is our new member who will be on the committee and be active with us throughout the rest of the term. Chris Burkhalter was appointed by the governor as our actuary. He's president of the Burkhalter Group. Amy Benson, I don't believe she's here today. She's a school teacher in DeSoto Central High School. She's, is she by Zoom? Yes, okay, thank you. Ms. Benson is here by Zoom. We appreciate you being with us today. And Laura Jackson is a retired state employee appointed by the Speaker of the House. And those are the members of the committee. Again, the legislation also calls for us to select a chairman and also to select a vice chairman / secretary, and then for records to be taken at the meetings and for our us to report to the legislature. And we're going to relax that November 1st date a little bit, but our goal is to have 3 to 4, no more than 4 meetings, and then have them all completed hopefully by the 1st of November and report our findings to the legislature. The first thing I'd like to do is we're charged with electing a chairman of the committee, and I would like to nominate Representative Hank Zuber to be the chairman of the committee, and I'll be glad to open for any other nominations. If there's someone else that would like to be in contention for that. Okay, hearing none, Representative, could we get a second on that, Senator DeBar? All right, all in favor, please say aye. Okay. Chairman Zuber will now take the gavel and will chair the meeting and take it from here.
Thank you, Chairman Michelle. Good afternoon, members of the committee, ladies and gentlemen, staff, whoever else we may have present. Let me start off by making a few opening comments and remarks. I want to, first of all, commend the chairman of the Senate Education Committee and the chairman of the House Education Committee. As you know, the genesis or the idea for this task force, this study committee, came from the education committees. As you probably know, we have given teachers a tremendous pay increase last year and a couple of years before that. And we have a situation where the health plan expense specifically as it relates to pharmaceuticals, has been increasing at a rate of about 20%, if I remember correctly, Mr. Chairman, year over year. Not just an annual increase, but year over year, about 20%. So let me come in and thank the chairman of the House and the Senate Education Committee, Dennis and Richard, for coming up with this idea and trying to put this task force together and to hopefully establish a beginning where we can focus on the issues associated with the state health insurance plan. I could not do what I do as chairman of the House Insurance Committee without a very competent and capable vice chairman. And present today is Vice Chairman Kevin Ford of the House Insurance Committee. Kevin, please stand, get recognized. Thank you. Thank you for everything you have done. And I'm sure Walter has the exact same opinion for his vice chairman, Michael McClendon, who is not present today. Okay, as you can see from reviewing the enabling legislation, we have some housekeeping matters that we need to take care of. First of all, that is the legislation requires a vote on the per diem. As you know, we have one or two, maybe three members of the committee that live a pretty good distance away from the Capitol. The enabling legislation does allow for a per diem that needs to be voted on. So let's go ahead and do that first of all. All those in favor say aye. Aye. Opposed, nay. The ayes have it. And Dennis, I guess since you are the vice chairman and the secretary, have we voted on that? Okay. I'm sorry, we need to nominate you first. Okay, secondly is the nomination and the voting on the vice chairman / secretary. That is the same position. It's not two separate or independent positions. The chair hereby nominates Dennis DeBar as the vice chair and secretary of the task force. All those in favor say aye.
Aye.
Opposed, nay. The ayes have it. Congratulations, Dennis. Okay. Let's look at the overview or the goals that we have been tasked to look at and address. We have 6 or 7 goals. The first one is to look at the financial state of the health insurance plan, including, ladies and gentlemen, the current reserves and the solvency of the plan. The second one is how is the plan, what is the governing board or the governing structure of the health insurance plan? That's something that we need to look at. Thirdly is the possibility of future rate increases and the impact that that will have on employees, their families, in addition to the governments at all levels, state, county, and city. Another issue is the benefits or services for employees that are received through the state health insurance plan. Number 5 is a comparison of our plan to other state health insurance plans, especially those that are close to us and in the southeastern part of the United States. Number 6 is any other information or recommendation that we may come up with to achieve a goal of having the plan be solvent and result in rates that are competitive and can be affordable to our employees and their families. Another housekeeping matter is to establish the next date for the meeting. The chair and the vice chair is of the opinion that our next meeting should be on September the 25th at 2 p.m. Does anybody have any conflicts or heartaches with that date and time? Let me repeat that, September the 25th at 2 p.m. Same location. Okay, hearing none, that will be the next meeting. Something else we need to look at is the actuaries that are being used for the state health insurance plan.
And I believe that's it for right now.
This was meant to be an organizational meeting and it may be a good idea to go around the room. I would like to mention a couple of things from having attended the monthly state and school employees management board meetings that I know are of importance right now that I would like additional information on. If I could just mention those. Everybody is aware, and it was mentioned at the meeting this last week, that there are quite a few drugs out there right now that provide dramatic weight loss. And there's no secret that the state of Mississippi is the most obese state in the whole country. They came about as being drugs for diabetics, and the problem comes in the whether insurance will pay for a weight loss drug or if they require someone to be a diabetic before they would pay for that. And I know there's several drugs in the pipeline right now, and hopefully that will bring about competition. One of the things I'm not aware of is whether the state plan pays for the stomach reduction surgeries, bariatric surgery, is that what we call it? Liz, is that paid for now? It is, okay. So maybe a cost comparison of how that program works. If we all know that obesity is at the heart of many different problems. And if y'all think it would be advisable, I would like to hear from some representatives, some of the companies that have a drug in this field. Something else, I don't know if the plan thinks it would be advisable to do a test trial on obesity with some of these drugs and do a trial run with however many people is suggested. This is all just for discussion right now. That might be something we would like to pursue. I think there could be no better state than Mississippi to where a trial could be run to find the results of all the benefits that come from losing a significant amount of weight. Liz, that was discussed at the board meeting last month, and I know there was an update. You gave us an update on it. Did you know, are y'all gathering information on it? Would you speak to that? Diabetes only. Yeah. Okay. Could we start with Chris? And if you don't have anything you want to say, that's fine, but go around the room and maybe suggest, so we'll have a very productive next meeting, things that you think would be good to do so that those of you who are professionals in the field can give us an idea of how to organize the next meeting. The goal is for the next 2 years to be 5% each year, or 5 and 6? 5%? 5% increase. Okay, thank you. Commissioner?
You know, it's hard when you can't even turn a microphone on, you got problems. I just want to clarify what Chris said. He usually blames me and wants me to make the motion on the rate increases because I'm the one in box. So I think there are a couple of things that we ought to be looking at. We need to constantly look at our drug costs at the state plan and the PBM methods that we have. And we do have someone that tries to control that, but the issue of AWP, average wholesale price versus PBMs, is going to be an issue. And we really need to be addressing that issue. It may be a way for us to enjoy some savings and avoid the complexities of what we call specialty drugs, which tend to be extremely high when they shouldn't be that high. So that's another issue. And then just as noon today, I was approached by another government entity that talked about, would it be possible for the state health plan to cover county employees? So that's an issue we ought to be looking at. It's not in the legislation, but you've always got people that want to get into the plan simply because it has been run extremely well. We've had some very capable managers and leadership. And I think that's enough. I've added, Liz may kill me for adding all that on there, but those are things that we really need to be looking at. And then long-term, you've got to understand the cause and effect of what would happen if we get out of sync with cost and how it would affect state employees. And there have been some people that have talked about, we shouldn't be offering free health care, which we don't essentially offer free health care to state employees. But if you do that, you're going to lose the pipe chain of young people getting into the program of being state employees. So there's a trade-off everywhere that you go. I didn't mean to add too much to it. Mr. LaBarre, since I'm a senator, it was your bill that we're talking about here. So.
Commissioner, are you aware of any states that have a waiting period before a state employee becomes a member of the plan?
There are some states that have waiting periods, and there are some states that contribute to the family cost also. So there's some yin and yang in the way that plans are administered. Alabama's plan's a little different from ours, and I think we have some of that history on file already, which will I'm sure that our chairman will provide to you.
Great.
And some states like Alabama, I think you have to pay 20% is paid by the employee. Used to be, and then you have differences for heritage and legacy employees, which we have in our state, and all of that fits in. So we'll put all of that. I assume, I say we, the study committee would probably put that into a plan. And just for the education chairman, teachers are not our problem sometimes. I'm talking about on cost. So. Well, yeah, well, the teachers make up a large percentage of the 100,000, 90 to 100,000 that we cover at any given time. That does not include our dependents. So when you look at your cost factors, you got to look at where 20% of the people cost you 80% of the dollars you pay out on healthcare. And we'll look at those numbers so that y'all can look at them. I was a part of, in '94, of drafting the plan to incorporate this state and school employees into one group. Dick Livingston and I on the House side worked for Billy McCoy at the time. So I often question our wisdom at what we did, but it was a really good move for the teachers in the state. Peace. I didn't give you anything else. I know you talk loud.
But would you speak into the microphone? Because that will we have people on Zoom that won't be able to hear you otherwise.
Janie. Mr. Chairman, I think we are always looking for ways to save money for the state, but by the same token, we are a self-insured plan and we have a fiduciary responsibility to our members to make sure that they are covered for the needs of their health. So I think that's a constant balancing act that we have. I think in the past, we've seen medical costs stabilize a little bit more than drug costs are very complicated, and it's a very intricate plan that we have to follow, and we're trying to analyze that and get the best return for our members.
I'm sorry, I'm having a coughing attack. But anyway, I defer to what Commissioner Chaney said. I'd also like to say that our people, the staff that runs the plan does a great job. They're always looking at deductibles, out of pockets and all those things that could possibly save the plan more money, but then balancing it against how it affects the state employees.
And if I may, real quick, that reminds me, something that I think we need to look into is, like you said, overseeing the plan is a lot of responsibility, takes a lot of knowledge and expertise. Senator Michelle, I think something else we possibly need to look into is raising the salary for the administrator of the plan. That sometime.
Okay, two things that come to mind for me, and just for those in the room that don't know, I used to be the director of DFA, so I worked on this, the board that oversees the health insurance plan for several years. And now I'm still in the plan as a retiree, and I am a non-Medicare retiree. And the law, if I'm not mistaken, sets the premium for non-Medicare retirees at 115% of whatever a single person in the plan would be. If I remember correctly, back from my days on the board, there is some data that shows what the cost to the plan is for each type of person in the plan. So as a group, are the non-Medicare retirees, are they costing the plan a significant amount of money as compared to what they're paying in premiums? Knowing that I'm sitting here as one of those and I'm still 7 years away from Medicare, is it time to think about changing that 115% cap? That's a question. I think that ought to be looked at, because if that group is costing the plan a lot of money, is it time to change that 115% cap? And then the other thing is, we have I'm the CFO at Mississippi College now, and we have a self-funded plan as well. We struggle with the high-cost specialty drugs, in particular, the ones that are related to weight loss and diabetes, and there are some others. So we're trying to put some things in place to encourage people to seek those through a different method than they are currently getting them. And I know I won't go into any details today, but anybody who wants to talk about that, we can talk about it a little bit further. But the other thing we also do is we have different levels within the plan at Mississippi College, to where if you are a healthy younger person and you want that, I know we have a base and select now, but we have also levels past that. And I think there are other southeastern states that do the same thing. That if you want to encourage them to put money in a health savings account, take a higher deductible and get a lower premium in return, should we look at some other levels in addition to just the base and select? And I think that's enough from me.
Thank you, Mr. Chair. At this time, I'll just kind of echo what Liz says, and just as opposed to looking at these costs of drugs right now, we're just in a research and review mode right now. So that's all I have.
Could you repeat the review, the what?
We're just in a review right now, just reviewing and researching, and just in a fact gathering situation right now.
If I may, will you have enough time to provide us the numbers and the statistics before the next meeting?
Yes, sir. We should have the time. We're working with our vendors, CVS Caremark, working with Blue Cross and Blue Shield, who's here today. We should be able to pull it together enough information.
Okay,
to
great. Thank
answer any
you.
questions that you might have.
Does the committee think it would be helpful to hear from representatives of the companies who manufacture these weight loss drugs to give a quick presentation on it, or would that be not good? Or I don't want to open a can of worms, but I'd like to learn more about them if these are coming down the pipe, or how far we are away from maybe allowing those for people who are not diabetic. Bert, what do you think? Have you had conversations with? I know some of the companies attend the board meetings. Are they? Would that be okay with the board if we had somebody give us a little quick presentation next time meeting? Lester, you got?
Mr. Chairman, we have a lot of data that we got from the AHIP folks that we'll be happy to share with you. And if you want to have a testimony, we'll be glad to hear that. It's something that I got a call last night at 8:30 at the house from a guy that takes, I can't pronounce it, Mounjaro, which is a weight loss drug, but it's also for diabetics. He's a diabetic and his numbers were down below about 5, and immediately they take him off, and he was complaining. And I said, look, our TPA is Blue Cross, and they're supposed to do that. They're supposed to look at it, and it's complicated, but we'll get it fixed. And we got it fixed this morning. It wasn't a big deal, but it's the consumer doesn't always understand it. So it's good for us if we look at that situation, because the cost of those drugs have come down. We have some data on whether the bariatric surgery works better than the weight loss drug, how long you have to be on the drug. Is it a lifetime commitment, which in some cases it can be. And these drugs are extremely expensive. And if you're going to do that, I would encourage you just in open meeting to have some very good dialogue with the pharmaceutical and the pharmacy boards, because they can offer us a good way to maybe save some money. And what will kill us in the program, this is my opinion only, and Lynn ought to address it, would be the specialty drugs. That's what's normally is killing the program anyway. It costs us a lot.
Commissioner, with that being said, just for the benefit of the members of the committee, what is the weight loss program? I mean, the weight loss drug that you just mentioned, what is the cost per prescription to the plan?
I think if I recall, I asked him to send a follow-up email and I could look it up real quick, but I want to say the cost of the drug was like $1,000 a month and he had been paying $25. And think about this is a retiree now. And I don't know whether they were Medicare certified or Medicaid. I don't know, because they didn't have it in them. It's a lot of difference if you're not Medicare or pre-Medicare retiree. But anyway, I can find out for you if you want to know for sure. But we've got some of that data and charts that will help you some. I would strongly encourage you to include the drug folks so they could give you some information. And you get an opinion that's outside of the drug people that we use to manage our pharmaceutical programs. They may not always concur with each other either. Does that make sense to you?
Chairman of Education.
Things. There it goes. Well, I can tell Laura when I'm already on Medicare and it's not a great thing unless you buy the expensive programs. I'd like for us to look at and see if it would help. And I don't know, some of the schools hire these outside firms to come in and their employees go there for services for drugs and illnesses or sickness, whatever, and then their families can use it. And I think they pay about $10,000 a year is what it used to be. It could be more than that now. And it really was saving employees a lot of money. And I would think it would save the state money, but I don't know. So I'd like to look and see how that works. And is it beneficial to put it in more schools? Some counties have it and some cities also have it. And they have a clinic in the area. And I know Long Beach Schools was sharing with the city of Gulfport one time, and they were together there, but you go there and you can get some drugs for little or no cost. And then if your kid's sick or something, you run there, it doesn't cost you anything. It's got to save our program some money though. I know it's a convenience for them and to save money for their employees, but I was just thinking if the other agencies or other schools did it, I'd just like to look at it and see how it would work. But I mean, I know that when my wife was teaching, that's where we went for everything. Sure. No, we pay for some of it. You have to have some nurses.
We've
yeah.
actually increased the number of school nurses the last several years, Commissioner.
And these nurses refer them to this clinic that's opened up there too. They, you know.
So we are in some dialogue at the department with another government agency, not the legislature, that's looking at clinics that they're establishing throughout the state in conjunction with some other healthcare providers. And we'll be happy to include that to see if they're available for especially schools, because these deal with municipalities. And it's tricky because if you've got people that are on the ACA, they can't be a funded plan. It gets complicated with ERISA and BWAS and all these things. It sounds like jargon to us, but we can look at that and include it in the program. It'll be a very short paragraph. Do you think we could do that, Bob? Yeah.
And I think the casinos have gone to this too. Now, I know that hasn't anything to do with us, but that's a cost-effective way that they're doing it. And I read some articles on it. It's really saved and helped them.
Well, I will tell you that we looked at the casino model for the municipalities to use in some areas of the state. And as your commissioner, I will tell you, we face everyday challenges on network availability, specifically in the Delta. And we're having to rewrite our regulations on networks. What constitutes a network? It's not 30 miles, 30 minutes, 60 miles, 60 minutes in a rural setting. It may end up being 100. We may have to go to using MEA or medical type clinics as your primary care physicians. It's really complicated. And you say, why are we in that as in the insurance side? Well, federal law will not let us allow those policies to be sold in some of the counties. Say, yes, the Queen of Sharkey would be a good example. Even now, maybe a LaFleur, unless we have an adequate network. So that presents a host of problems on the insurance side.
Commissioner Bob, if I may, Chairman Bennett brings up a good point. A possible source of information may be to contact somebody with the Ocean Springs School District, because they have some type of an agreement, like Chairman Bennett mentioned, or a relationship with Singing River Hospital, where their employees can go directly to the Singing River Hospital Clinic. Anything else, Chairman Bennett? Chairman DeBar?
Thank you, Mr. Chairman. To say that I know much about how this plan works or anything would be a vast understatement. Insurance is not my area of expertise. That's why Richard and we talked about this and got this passed to learn more. But the impetus for this, for us, I think, for me especially was, for 12 years, I live along the Alabama line, and the price for insurance it's a great discrepancy. And no one really could give me a good answer as to why that was occurring. And so I don't know if the legislature subsidizes their plan or what, they have a better plan than us. But when you had teachers up until last year who really, their costs were increasing, but their pay was basically the same, they were losing disposable income. And so I'd like to find out why and what they're doing in other states around us. And that's why the legislation is the way it is. So if there's a way we can figure out how that is occurring, what we can do to rectify the situation to make it more affordable. I like what Ms. Jackson said about the health savings accounts. We have young people, single most of the time, that really don't want to pay insurance. Or if they have a family and they're married, they don't have kids, why should they be paying the family rate of $1,000 or whatever when they can pay something less in the HSAs, for example? So there's got to be better ways we can help recruit people where they have more disposable income in their pockets. I'd also like to hear from maybe, Mr. Chairman, some people that are on the plan, just teachers or MDOT employees or whoever the case may be, if they work for the schools or the state. What are their major concerns? What is it they think we should know as we go forward with this. I don't like the insurance. I mean, 5% increase doesn't sound like a lot according to you, but for me, it sounds like why? What's going up that would justify that? And why is it keep increasing when, on maybe inflation and maybe whatever, I don't know. And so I just want information as why this keeps increasing and what we can do to rectify it. So I think we have a great plan. I think the insurance that was provided by the state is good, but I'm just very concerned about the costs. And Commissioner Cheney, the last part of the bill, or I guess I says any other information. So that means you can add anything you want to it. So it'd be all good. So thank you, Mr. Chairman.
Thank you, Mr. Chairman. The example you used, Liz, I have a question for you to follow up on Chairman DeBar's hypothetical. What if you have a 21, 22-year-old teacher starts working for the state of Mississippi, let's just say at the Ocean Springs School District, and he or she says, I don't have any problems. I don't have any medical issues. I don't want that insurance premium taken out of my paycheck. I don't want the insurance coverage. Does he or she have the option to not take it? Okay. Thank you.
On that subject, for a state employee, not a school teacher, that's going to be paid for the employee regardless. Can they opt out now?
Completely.
If they opt out, what's the financial benefit to them? If it's self-insured, it's not coming out of their check.
Right, nowadays.
Is that not a problem with Affordable Care Act?
But, Mr. Chairman, I think they're put in a position, it seems to me, where they either have to pay for insurance or not, and they don't want to spend the cost. And at some point, unfortunately, something could happen to them. They get in a car wreck or they have the diagnosed with cancer or something, and they don't have insurance. I don't think that's a good model because that's going to cost them more in the long run, as you all know. So if there's another way where they can put a little bit of money, save it aside, set it aside, like the HSAs Laura talked about, what we can do to help keep them covered so we don't bankrupt them if something should happen and they're still provided some type of care.
If I may, let's take the flip side of that hypothetical. You have an employee that smokes, drinks, bad eating habits. Are there any incentives for good habits, good health habits in the plan? What's the charge?
We just changed that last year, though. That was, is that much of a,
Oh, Commissioner, I'm sorry, go ahead.
is that much of a,
So we removed the surcharge for smokers last year? Okay.
we actually allowed the plan to have a surcharge for smoking, if I recall the legislation correctly. The legislation was such that a smoker could not be charged any additional fees. So what?
Are we receiving benefits from the wellness plan in terms of numbers? I mean, sheer statistics. Okay, anything else from the members of the committee?
One last thing,
Sure.
going back to the uninsured, based following up on what we're talking about. Are these people, if they decline our insurance plan, are they going elsewhere where it's much cheaper? And so if there's statistics on that, where they decline our plan, are they going elsewhere because it's cheaper? Do we have data on that? I can think of a few people that have done that themselves, so.
Commissioner, that reminds me, I've seen the comparison in the numbers between Mississippi, Alabama, and I think Tennessee. And I thought our family plan was actually less expensive than the Alabama family plan.
Great. Yes.
Chairman Bennett?
I want to say something about the people being on their spouse's program versus the $26. I think some people back away from it because of the fight between the two insurances or who's going to pay. I know I had that problem a bunch of times and it's set out there and it's fight over which insurance is going to pay and it held me up a lot. I finally dropped one of my insurances.
Well, if you take a program, then only the primary care person has that program. It's a little different once you make money to, Medicare and Medicaid, as whether or not the primary.
Well, I had Aetna with the retired DuPont, and then I had Blue Cross, and they fought, and I mean, it would go on for a year or so, and I mean, it was not worth it. I finally dropped one of them just because it was with my wife and everything. It was always a fight over who was going to pay it, and I had those bills laying out there, and people calling, and they kept saying, no, it's your primary, or this one would say, no, they're the ones that should pay, and it was a mess.
Chairman DeVar?
Thank you, Mr. Chairman. I guess if we sit here long enough, I'll think of more things. I apologize for that. Well, Verizon report. Well, one of the thing is, I think, last year you did a great job mediating that dispute between the MMC and Blue Cross. Is there anything we need to do to maybe address through this committee a way to prevent that from happening again? Or is there anything? I don't know, but I just don't want people to feel like they've been, it says any other things. We can talk about anything, Mr. Commissioner. So I don't want.
Be on record for what I'm going to say. I'm a firm believer that network agreements between a medical provider and a health insurance company is a private contract matter. I don't like people being out of network, but it does happen, not only in our state, but in several other states. And the case that we have with the one that we did resolve in December between the University of Mississippi Medical Center and Blue Cross Blue Shield, that was a 9-month event. My concern was for those people that the only place they could go for a liver transplant or for a kidney transplant was the University of Mississippi Medical Center. And to us, that exposed the issues of how do they get medical care if it's a life-saving transplant? And we had to address the issue that you could go to Memphis to get your liver transplant, or you could go to Houston, or you could go to Birmingham for some subject. And to Blue Cross's credit, they tried to cover the expenses of going where they needed to go. And it's no secret, I was mad at both of them. I'm very vocal about it, and we got it settled, and hopefully they love me some more, I don't know. But I would be very cautious about trying to get into mandating of networks. We have just recently rewritten our regulations to address that issue without coming back to the legislature. We have that authority under existing law. We got comments from 2 major carriers, very few comments actually, and most of them dealt with the constitutionality of us mandating travel expense. And we've got that addressed. I got an opinion on that today. They're not going to like it because the opinion's in our corner. And it basically says that you will pay the travel expense either for 100 miles or more or at the federal per diem. And I'm talking a little ahead of myself because we'll probably run that through some actuaries again, just to be certain that we're okay. But those are the issues that I just don't think that the legislature wants to get into. And we have a network that's operated for the state health plan that works extremely well. And we've had, you have 2 directors right here now. You could ask them. I think it's worked fairly well. And we've been able to resolve most of the problems that we have on complaints. And I'm sorry, I feel like I'm the spokesman for the health plan, and I sure don't want to be. But I will tell you this, you need to get somebody there from the State Board of Education to attend those meetings. And they're normally there, but they need to be more active. And Dr. Rankin's there with IHL, he's active, and that affects a lot of people. Network problems may surface because of the lack of access to healthcare in the river region counties and in the Delta area. And without trying to raise the alarm, I can tell you that we're going to have some very severe problems within the very near future. I'm talking about 6 to 24 months. We're going to have some hospitals that close. And we are in the process of working with another private group to fund a study to look at healthcare access, not only in the Delta, but the whole state of Mississippi. And it does not involve any legislative money. We've tried to keep the proper legislative people apprised of what we're doing. And I'll be happy to talk to you about that if you're interested, because it will involve some of the areas that you represent, Senator. And it will involve the Gulf Coast too.
Yes, sir. Before I forget, is there anybody on Zoom that would like to be recognized to provide input to the committee? Okay, hearing none. Any other comments, information, suggestions? Okay, one last matter. The chair's of the opinion, the chair's interpretation of the statute is that the meetings need to be finished by November, but we could actually issue the report next session. Is there any objection to that interpretation? Okay, hearing none, that's what it will be. Anything else, members? Once again, thank you for your time. Thank you for your willingness to serve on this committee and provide your expertise and information to the committee. Mr. Chairman, do you have a motion?
And adjourned until September the 25th.
All those in favor say aye.
Aye.
Nay? Yeah. Commissioner? You just got in.
Has very little to do with the healthcare, but I will tell you that since both of y'all are chair of insurance, we've got a crisis that's developing among the counties to get proper coverage for liability and property. Several counties cannot get coverage, and we're working feverishly trying to get coverage. We're having to call a lot of chips in. I got a call about Humphreys County today. Had a glass of tea at noon with Derek Surratt over that very issue. And I want you to understand, if counties can't get coverage, we're going to run into a real buzzsaw, because sometimes that involves the schools. And the numbers that we're looking at are just incredible. I gave Mr. Burkhalter, who's actuary for the wind pool, some notes, and we're looking at some hefty increases for that we have to approve for the wind pool, and that will affect everybody in this room. On the commercial side, churches can't get coverage, commercial buildings can't get coverage within the Gulf Coast area, and we have problems not just there, but all across the state of Mississippi. It's coming, and that has nothing to do with health insurance, but it does have. It's a complicated issue. The cost of reinsurance, when you have a war in Ukraine, you have the wind blow somewhere else. It's crazy. When you have a hurricane in the Gulf, and Chris is going to tell me in a few minutes whether I should approve or not approve another buy on reinsurance for the wind pool. They're trying to buy it before the storm's named. We're worried that if the high moves a little to the west and the high and the eastern part of the country stays stationary, that hurricane would change from the west going east. It'll come straight up. And you know where that's going to be? Mississippi and Alabama. And that's what we want to avoid. If we don't have enough coverage, we got some real problems. That's just to make you aware of some of the things we talk about.
Thank you, Commissioner. Okay, the committee is hereby adjourned.